Welcome to the Prescription for Admission podcast, where we talk about hospitals and hospital-based care, who you can expect to meet, and what you may experience during your time in the hospital, both as a patient and also as a healthcare provider working in a hospital. My name is Dr. Monique Nugent. I am a practicing hospitalist and also the author of Prescription for Admission, the book, where I talk about many of the same topics. Thank you for joining me and enjoy the show. Welcome back to another episode of the Prescription for Admission podcast with me, Dr. Nugent, your host. And we're starting a series for June. June is Alzheimer's and Brain Health Awareness Month. And this month, I'm going to focus all my episodes around caring for someone with dementia in the hospital and also brain health, things that are not dementia that also can happen to your brain and how that plays out in the hospital. So if you are listening to the quick tips are all also focused on dementia and brain health in the hospital, and those are really good, and those were a lot of fun to record, so go back and listen to those. And I want to start this episode off with a story. So a thing about me is that I am prone to getting phone calls and text messages from people who I either don't know, but know me through my family, or I know and they always reach out to me around their parent going to the doctor and needing things in the hospital or the doctor's office. So this was one of those calls. Hey, Monique, mom hasn't had a bowel movement in 7 days. She's been visiting us. She's out of her own environment. She's at my house and she has not had a bowel movement in 7 days and she doesn't feel good. We've tried everything. We've been trying stool softeners. We even did a suppository at home, taking her on long walks, drinking lots of water, but she's just not going. And so we're going to go to the hospital because she's constipated. So I said, oh, okay. So you want to be admitted to the hospital? Oh, no, no, we're just going to go to the hospital and maybe they can help us do something different. Maybe a disimpaction or an enema, something that they're like set up to do that we can't do at home. We just wanted to touch base with you because we're going to go to the hospital. I said, okay, she's going to be admitted. No, we're not going to be admitted. We're not going to be admitted. No, she's going to be admitted. If you don't want her admitted, do you feel like she needs to be admitted to the hospital? No, there's no reason for her to be admitted. We don't want to be admitted. They went on this whole thing about we're just going to go to the hospital to get help for the constipation. Fast forward several hours later, I get a phone call. Okay, so they admitted her. And that admission ended up being, I think it was for that person, it was like maybe 2 or 3 days. And at the end of it, she was no longer constipated, but my friend was like, I don't really know what happened. I don't know how we ended up getting admitted. And did she really need to be there for that long? And now everyone was out of sorts. And mom's visit was complicated by this hospital stay. So I tell the story not because I want to shame anybody. If you're going to the hospital for help, you're going to the hospital for help. You're usually going because you were like my friend. There's something going on that you've tried to intervene on and it isn't working, or you're taking your loved one to the hospital because there's something clearly out of your depth, right? They're too sick. They're in too much pain. They're confused. Something is different. Something is maybe dangerous. So you're seeking help. But I want you to be aware that if you are coming to the hospital, there is a possibility that you will be deemed appropriate for admission. And as you get older, that likelihood goes up because when she showed up with her constipation, they did some blood work and they found she was a little dehydrated. Yeah, she was a little dehydrated because she was constipated and she wasn't feeling well. She didn't want to eat or drink because she was nauseous. And then now that dehydration is a reason to say, hey, maybe she needs some IV fluids. And if she's getting IV fluids, we really should watch her because she has a little bit of heart failure. So we should put her on the cardiac unit because she's going to get IV fluids. We don't want her to go into heart failure exacerbation. And if we're treating her for dehydration and treating her for constipation, then she's hooked up to this IV. She's not going to get out the bed. So since she's not getting out the bed, that means she's high risk for DVTs. And it just snowballs, right? And the snowball ends up with an admission that maybe you weren't planning on or didn't really think was necessary, or ends up with an admission that can complicate things and maybe even have bad outcomes, right? So if you are caring for somebody with dementia and you are going to the emergency department, I want you to go with your eyes wide open. That interaction may end up with you being admitted or them being admitted, right? That may end up with a hospitalization. And I want you to think before you go there, do I want my loved one hospitalized? Is this the right thing? And if the answer is yes, we're going there because we're out of our depth and we're uncomfortable and we need more help than what we could do at home, then yeah, go ahead, get admitted. If you think twice and say, wow, the idea of mom or dad or my husband or someone being admitted, that bristles me a little bit because either we've had hospital stays that didn't go well, or they don't do well when they're not at home, or I just feel like we just need a little bit of help. I can do everything else at home. We have access to other things. If that makes you bristle, I want you to lean into that. I want you to lean into that feeling and that question and ask the emergency medicine physician. That is a person who says, oh, you're too sick to leave, you should be admitted, right? Ask them what specifically is concerning and how maybe they can work with you to find a plan that doesn't end up in the hospital, right? Or if you're already meeting someone like myself, you're already meeting the hospitalist, ask me, do we really need to be hospitalized? There are things that will say, yeah, you do need to be, this is unsafe. And then there are other things that will happen where I'll say, let's see what we can do. Let's see how we can work with this. And the reason why I want you to do that question when you are caring for somebody who has a dementia, and through this series, I'm going to refer to it as a dementia. Alzheimer's dementia is a type of dementia, but there's so many different types of dementia. And I want to focus this month on supporting people who are caring for people with a dementia. So just snowballing all of them together. If you're caring for somebody with a dementia, I want you to question, because sometimes the hospital is not the best place. I know that may sound like heresy coming from a hospitalist. That may sound like heresy coming from a physician. I want you to know that it's true. Even us will sometimes bristle and say, do we really need to hospitalize somebody? Because let me tell you what happens in the hospital. In the hospital, you get put on this conveyor belt of healthcare where all the things that need to be done for quality, and I'm giving air quotes there, quality will be done. And those things can sometimes lead to more complications. For instance, falling is bad. Yes. Falling in the hospital, ultra bad. The hospital works really hard to ensure that people don't fall down, right? They have tons of initiatives. There have been studies about it. Your nurse, her ears are perked up for the alarms that go off to say, oh, someone's got up, someone's at risk for falling. You can't even go into the bathroom by yourself. Certain patients are not allowed in the bathroom by themselves because we are afraid of them falling, right? So what do we do when you're afraid of somebody falling? You don't let them get up. You say, hey, sit down, lay down in the bed. You put alarms on the bed so that every time they get up, now it's like, wah, wah, wah. That's startling, right? People then come running in and get you back into bed, right? And so now dad's been in the bed because we're afraid of him falling. And what happens? Gets weaker, gets deconditioned. That weakness, that deconditioning now makes it harder to get out of the hospital. And so it's not that I don't want you to be admitted. I've named the podcast Prescription for Admission, right? This is my prescription to you if you get admitted to the hospital. This whole thing is based around people being admitted to the hospital. But this conversation is to make you pause when caring for someone with a dementia, because a hospital stay can be very hard on them. A hospital stay can lead to delirium. We're going to have a whole episode where we talk about delirium, but delirium is that confusion that happens in hospitals. A hospital stay can lead to falls. A hospital stay can lead to deconditioning. Hospital stay can lead to adverse outcomes on medications. A hospital stay can lead to decreased eating and drinking because they don't like the food, because they're out of their environment, because they're not used to who's feeding them. A hospital stay for someone with dementia is very different than a hospital stay for somebody who's 22 and come in for a broken leg. Very different experience. And people oftentimes have a very hard time bouncing back after a hospital stay, right? So there is hospital associated cognitive decline, meaning from being in the hospital and being sick, people get a little bit more slowed down, a little bit more confused than they were before, and they don't come back up to that previous level, right? Hospital stays are tough. They are very tough on our elderly patients, and they're very tough on patients with the dementia, extremely tough. And so I want you to question. I don't want you to question getting help. Please get help for whatever the thing is that you need. And there is a huge list. There's a textbook worth of reasons of why you should come to the hospital to get help if you feel like you need help. The number one reason is you feel like you need it, right? But I want you to, yes, come to the hospital, get help. Go to your primary care doctor, get help. Call the visiting nurse, get help. But if you really feel like a hospital stay is just not warranted or just not the thing you want to go through again, I want you to ask what alternatives there are to being acutely hospitalized, right? Can we be observed for a few more hours? Can we maybe be discharged to a skilled nursing facility? Can you send visiting nurses into the home? Or do they really need IV antibiotics? Can these antibiotics be in pill and we can go home? I want you to question, ask what resources they have, because a hospital stay when you are having dementia is extremely difficult and can lead to a lot of unwanted and poor outcomes. And then for you as a caregiver, I know you need the help. And that's what hospitals are there for. That's what I hope hospitals are there for. And that's why I do the work that I do. And that's why I love hospitals, because I feel deeply in my heart that a hospital should be a place where you come to get help, and you can get that help in so many different ways. So if you're in the hospital, this is the time to ask for things and say, what services can I get? How can I get my loved one back home so that we can get back into our environment, we can get back into our routine, and I get the assistance that I need? Because if you really want to avoid more complicated things at home, you want to get as much support as you can. But if you're questioning it, lean into that question. Sometimes, like I said, the answer is really obvious. I'll say, nope, their blood pressure is too low. It is not safe to leave when their blood pressure is that low. Other times, you put a little tickle in my brain and help me to think, right? And so ask about other options that don't require someone to stay in the hospital overnight. If that hospital runs a home hospital program, please ask if you're appropriate for that. I love home hospital programs, particularly for our elders, particularly for people who have some cognitive issue or culturally are not from the US and maybe don't speak English, don't like the food, are uncomfortable in the hospital environment. I love hospital at home for people with a dementia. They don't have to be out of their environment and their routine. They can stay at home and get the care that they need. So ask if the hospital has that program. Ask. And then if they're being admitted, if you had the conversation, you've asked all the questions, and everybody is on board that, yeah, we need to keep them overnight. We need to do an admission. We need to do other things. This is where I want you to lean in early and ask for everything you think they could need to be supported and to stay as oriented as possible. You can spend the night in the hospital with your loved one. I worked last night and I think I got 2 or 3 pages about loved ones who were sleeping over to support their patient, right? You can ask for that if it will help them be more oriented, if it will help them to eat from you. Please, this is the time when you're getting admitted. Now is the time to ask for the special hospital bed, to ask for the wound care, to ask for the physical therapist, to ask for the speech therapist. Get it all out there. It is so much easier to pull things back than it is to get things when you need them, right? So if they're being admitted, now is the time. Early on in the hospital stay is the time to ask for all the things that they need. Ask about quiet hours. Can they not have their vitals checked overnight? Everything you can do to support their rest, but also everything you can do to support their orientation. Do they have a room with windows? Please open up the curtains in the daytime. Can they come out of their room and walk the halls during the week? What's that going to do? It's going to cut down on deconditioning. It's going to cut down on delirium, right? Mobility. Early mobility helps to cut down on delirium, right? Helps to cut down on confusion. So ask for those things early and then also plan early for what going home will look like, right? I know that this doesn't sound like maybe things that are a lot different from what I'm talking about usually, but for when you're caring for someone with a dementia, you have to be so proactive about these things in a hospital because things will fall through the cracks and then when it's time to go home, you don't have them, right? And also getting back to the first point of this conversation is, do they need to be hospitalized? Understanding what the risk of hospitalization is. It's not a benign thing, right? It's not just a pit stop somewhere. A lot of things are going to happen. I remember after I had my babies, each and every one of them, I would look at my arms. My arms were covered in bruises from all the different IVs and all the different blood pokes that I had while I was hospitalized, right? The discomfort of being in the hospital, tubes. And then there's the finances. You get them into the hospital, there's going to be a financial repercussion, right? Maybe you don't like the word repercussion because it sounds like you did something wrong, which you didn't. But what I mean is there's always something financially that's changing after you're hospitalized, right? There may be new prescriptions. There's probably a copay for the hospital stay. I can tell you that it's going to happen. So think about how you can best support your person. And does that support have to happen inside the hospital? I recorded a podcast with another person, another physician who also is in this space. And that was the thing we talked about. Do you have to be hospitalized? You can get so much care at home. You can get so much assistance to stay in their environment. I can guarantee you a hospital stay is going to be really difficult for somebody who is confused at baseline, right? May not fully know who's who. Now, suddenly, there are nurses, nursing assistants, sitters, and those people change every shift. It's crazy to think they're going to keep that straight, right? So, yeah, I want you to just question, is a hospital stay really the thing that we need for anybody, right? Don't just accept it. Sit down and ask, what exactly are we doing? What exactly are we treating? And why can this treatment not be done at home, not be done in a different environment? There can be lots of really good medical reasons. There could be lots of really good logistical reasons, but at least you have the answer instead of just blanketing going along with being admitted. So my friend who took her mom to the emergency department for constipation, they spent 2 days, I'm pretty sure it was 2 days in the hospital. And when she came out, she was like, wow, all that. Now we have all these things. There's new prescriptions, and mom still doesn't feel great. Yeah, now she's having bowel movements, but she doesn't feel great. She now feels more tired. She now feels more deconditioned. She now has little pains here. And I think her mother also, unfortunately, suffered a skin tear. And so that was not what they wanted, right? The bandage was taken off and the piece of skin ripped. And now you have this wound to care for. And I just felt really badly because I know that's not what they want. I know that they went there looking for help and they left feeling like they got some help, but also got more complications than they bargained for. So understand that hospitalizing someone with dementia is not always the best thing for their dementia, for their brain. And you can push back and question. And then also, if your hospitalist, if your emergency medicine physician is questioning, saying, do we really need to admit them? That might be what they're thinking about. They may be thinking, how can I help someone avoid the experience and the traumas of being hospitalized? If they came in previously and had a delirium and we have record of it, then we know they're at increased risk. And we may be questioning and saying, how can we think about things differently? So that's my message for this first episode of June. When caring for someone with dementia, if you're going to the hospital, know there is likelihood that you might be admitted. There is a possibility you will be admitted, right? Ask yourself as you're driving there, am I okay with that? And if you're not okay with that, then question. If they say, oh, they'll be admitted. If they're saying, oh, we treated their constipation, here's some extra stool softeners, you can go home. Hey, win, that's great. But if things change and they say, hey, we think they should be admitted, ask why. Because I guarantee you, with enough blood work and enough imaging, we'll find something that we could say, oh, a hospital stay could help here, right? I'm not saying don't get care. I'm not saying don't get help. I'm just saying think. If you're going there and you're not going with the expectation of being admitted, ask yourself, how will I feel if they say she needs to be admitted? What are we trying to accomplish? And can that be accomplished at home? So that's it. That is it for this first episode of June, Alzheimer's and Brain Health Awareness Month. I want you to come back for the next episode. This is a series. We're going to be talking about all things dementia and brain health when it comes to hospital stays. And also check out the quick tips. They are a lot of fun and they are really high yield this month to help you out. My name is Dr. Monique Nugent. I am your host, and you can find me on my website, which is drmoniquenugent.com. And when you go there, you can find all sorts of great things to support you as you are supporting your loved one. Thanks, and come back again. Bye.